You can go.
Oh, you started it? Okay. Hey, my name's Caleb Jager, and I'll be debating on behalf of the Sarcoptes scabiei mite, or as it's also called, the itch mite.
And I'm Cassie Stricker, and I'll be debating on behalf of Demodex canis, the follicle mite.
And our topic is which one is more difficult to control or mitigate. So I'll start out with the Sarcoptes scabiei. We know, as far as we know, they have been here a long time, as far back as 2,500 years ago. The first time that it was discovered was in 1687, whenever we discovered that it caused the scabies disease, which is the reason that this insect has a negative impact on human society. This insect, the name for it comes from the Latin word scabiei, which means to scratch, and that is because these insects burrow into your skin and cause this disease called scabies. And you can see like the bumps from the insects under your skin, and sometimes it burns and itches, and a lot of people scratch them, and it's a really bad thing because secondhand diseases can come from all the excessive scratching. And then in some cases, people can wind up with what's called Norwegian scabies, which is basically just an excessive amount of Sarcoptes scabiei insects living inside you. And this can get really hard, almost impossible to get rid of them in this case, because there's just so many, upwards of 1 million in some cases. And there are only two methods of dealing with them, or two primary methods that actually work. And the first one would be permethrin, and the second, malathion. And these are both insecticides, which can be harmful to certain organisms. So we really haven't developed a great way of dealing with the scabies disease, even in today's age. And always, even if you do treat them, they usually do come back. Most of the people that have them, they have them all throughout their life. They come back. They just keep coming back. And so as for their biology, they go through simple metamorphosis. They start out as an egg, then to larvae, nymph, and then adult. It takes about 2 weeks to go through their life cycle. And the adults can live 1 to 2 months. They're flattened ventrally with sucker pulvuli, which enable them to hold on to their host so they don't fall off. And they have cutting mouth parts to burrow under the skin, and also they're more suited to colder weather. So during winter, there can be higher outbursts of these insects. And you can take it from here, Kate.
Okay, so Demodex canis go through incomplete metamorphosis, which means that they're going to look like their mom and dad before they're fully grown adults. They're very tiny insects, and you can't see them with the naked eye. They're roughly 0.3 millimeters long. The adults have 8 legs and slender, elongated bodies, and they're said to look like cigars. The bodies are also covered in scales that are used to anchor themselves into the hair follicles. They usually come out of the follicles at night as they try to avoid light, and this is when they mate. After mating and the follicle opening, the females will burrow into follicles to lay their eggs, and the eggs are absolutely impossible to wash out. You have to wait for them to hatch and then treat the mites rather than getting rid of the eggs right from the beginning. So it takes about 3 to 4 days for the eggs to hatch after being laid, and it takes them about a week to develop into adults, and the total lifespan is about 2 weeks. So when the larvae hatch, they have 6 legs, and they'll undergo several molts to become 8-legged nymphs and ultimately adults. So these insects move very slowly, about 1 centimeter per hour, and Demodex canis reside deep in the dog's skin. So transmission is usually only possible with prolonged direct contact. They can only live for a couple of hours away from their host in a dry environment, and they can live a little bit longer in a wet environment like a damp towel, but ultimately without a dog, they'll die. Demodex canis cause mange when their population is too large, meaning that dogs have to deal with patchy hair loss and in some cases severe pain. And it's not contagious since all dogs will have Demodex canis on them. The bugs themselves don't necessarily cause the mange, rather the overgrowth of them that can occur when the dog has immune defects.
All right, and so my question for you is, the Demodex canis infests mainly dogs and doesn't survive well on other mammals like humans. And seeing how dogs are not always in contact with other canines, unlike humans are usually in constant contact with other humans, how do you ensure the survival of the Demodex canis with less than optimal chances of transmission?
Yeah, so all normal dogs are going to have at least a few of these mites on their skin. As long as the dog's immune system is functioning properly, you're never even going to know that they're there, meaning that you won't know to treat for them unless the population gets out of hand. But even if you do treat for them, treatment options are limited and often risky, and you still most likely won't be able to get rid of all of the mites. Like I said, they live deep in the hair follicles of a dog, so they won't be transferred to other dogs unless there's prolonged contact. There is, however, transfer from mothers to puppies during the first few days of life, which ensures that the mites are going to live on in a new generation of dogs, because pretty much all puppies are going to have direct contact with their mothers, so they're guaranteed to have at least a few follicle mites on them. So my question for you is, what happens when itch mites lose their host? Will they die too, or can they find a new host?
All right, that's a good question. Well, it's not very common for them to lose their host because most of them, all of them actually, except for the males and the nymphs, because they're too young to burrow, and the males, they don't burrow unless they're just looking for a mate, which is really all they do. So every other mite is going to be burrowed under the skin, so they won't fall off, per se, of their host. So the only reason that they usually would lose a host is from the death of the host. And in this case, they do have a mechanism that allows them to find another host or to find the one that they just lost or whatever. So they're very sensitive to odor and thermal stimulus. So if something like a dog or a cat or a human walked by them, they could smell their scent and then track them down by their body heat and temperature that they're giving off. And that enables to track them down and then find a new host so that they can survive. And this is bad news whenever outbreaks occurs in highly populated areas in dense spaces like hospitals or family households, but especially in hospitals because of the poor health of the patients. If you're in poor health, that means that it'll be easier for them to begin colonizing on you because your immune system won't be as great if you were not diseased already. And so this could lead to Norwegian scabies and just really bad things. But the mites, they have 2 or 3 days. That's the amount of time period. That's the time period that they have to find another host before they die. And seeing that the wide variety of hosts that they have, like they can infest dogs, cats, foxes, a bunch of different mammals. So they have a bunch of hosts at their dispense. So it's likely that one of those would happen across the parasite at some point during those 2 or 3 days. So yeah, on to you, Cassie. Oh no, I'm supposed to ask you a question. Once an animal becomes infested with the Demodex canis, are the treatments usually cost effective and easily administered? And so that means that the infestation's easily dealt with?
Well, you would think that it would be really easy to deal with just a couple of little bugs, but unfortunately for dogs, Demodex canis are not just like fleas or something that you can just get rid of quickly. So topical treatments must be used cautiously because they contain a strong insecticide that can cause side effects in both dogs and humans. Most localized cases of demodectic mange occur in puppies younger than 6 months old, and they'll resolve spontaneously without treatment. However, if the dog has generalized mange, meaning that it's all over the dog and not just in a localized spot, it could require extended aggressive treatment for the mites, as well as evaluation and treatment of the underlying immune system problems. Because the problem is not the mites themselves, it's the overgrowth that is able to happen because of immune defects or systemic disease. So several months of treatment may be required. The dog is required to have several skin scrapings, and it's not even declared cured until like a year of clean skin scrapings has gone by. So several months of treatment may be required. The therapeutic goal is to resolve hair loss and scaling, crusting, redness, rawness, and other lovely skin symptoms. And also, in order to treat this, you essentially turn your dog into a walking insecticide because the mites feed off of the oils in the dog's skin. So in order for treatment to be effective, it has to be in the oils that the dog's skin produces. So it's also recommended that dogs who have generalized pneumococcosis be spayed or neutered so that they can't pass on the defect. So it's not like a let's just get rid of these few little bugs. It's like a either you have to be a walking insecticide or you can never reproduce. So it's not just a little problem.
Good explanation. All right, well, to close out my statement, the Sarcoptes scabiei, they've been around for a long time, ever since ancient Egypt time, that long. They're responsible for 300 million and plus cases per year of scabies. And this is a worldwide problem. It's not just in one region. Even the US has problems with this, even though it is in smaller areas, more impoverished, but the US even has problems with scabies. In my opinion, they're an understudied species, with the World Health Organization just recognizing them as a problem, I believe in 2015. So some scientists and researchers, few of them, are actually trying to figure out better and more effective methods to get rid of these pests. But so far, all that we have are insecticides like permethrin and malathion, which I said are hazardous to certain organisms. For example, in cats, if a cat was to ingest these substances, then it could be lethal to them. And seeing that this species is a parasite to humans, it's kind of difficult to find a method that doesn't compromise the health of the host, since insecticides can be dangerous to other things, not just the insect. And Sarcoptes scabiei, it's a species that's difficult to mitigate. The species needs to be taken seriously as a parasitic threat. They do not merely cause itching and scratching, but they can also lead to other diseases because of that scratching that the host will do. And this can even lead to disability and in some cases death. For such an old pest, we should really have developed better ways to treat them by now, but we just haven't taken them seriously. So that's what we need to do.
And to close out my argument, Demodex canis are present in all dogs and they don't go away without a fight. I think there's still a lot to be learned about them, as there aren't a lot of effective treatments that don't have nasty side effects. Like when I was trying to research them, I could find all this information about mange, but not really a lot about the follicle mites themselves. So I think there's still a lot to be learned about how we can effectively control them. But right now, they are just a big problem for dogs. So all of the sites that I found said the same thing too. If your dog has this mange, then just don't breed them. That's the only way to truly prevent the disease. You can't simply give the dog a harmless medicine or use an ointment to control the follicle mite population. The medications can be harmful to the dog, and unless you solve the underlying problems with the immune system, it won't be very effective anyway. Approximately 10% of affected dogs will never be cured and will require medical management for the rest of their lives. So these little insects, while typically harmless, can cause a lot of problems for dogs and their owners.
All right. Well,